Good afternoon, and thank you for joining us. My name is Tina Tebow, and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Today we are announcing 9 new cases of COVID-19. 5 of the new cases are in Central Zone, 1 is in Northern Zone, and 3 are in the Western Zone. We're experiencing an outbreak at Eden Valley Poultry, a processing plant in Berwick. We have tested all employees and staff, and a number of cases have already turned up. We are waiting for over 300 test results to come back in. There is no evidence of community spread at this point, but we have to act fast. We are announcing today this plant will be shut down for 2 weeks, and starting immediately, we will enhance our testing throughout the valley. There will be mobile testing units and pop-up units in locations for everyone who is asymptomatic to get tested. Dr. Strang will have more details. The Minister of Agriculture and his team are working with public health and the plant operators to support the company and as they manage their business. But I want to say, first of all, a big shout out and thank you to this company for their cooperation. And I want to thank all of them for putting public health and safety first. It's not easy to shut down any company, and this chicken plant is a large employer and is a big part of our food supply chain. But we have to do what we have to do to protect employees and community, and we need to try to prevent any further spread. Today we are also reporting a second case at Shannon Park Elementary School. That school is currently closed and was set to reopen on Monday, but now it will reopen on Wednesday, pending what we learn in the contact tracing. Each time we find cases in schools, we shut them down for a number of days at the very least while we do contact tracing. I want to thank the teachers, the administrators, the parents, and students who've all been working hard to follow the protocols. And I want to give a big shout out to our cleaning staff who are working tirelessly to sanitize our schools to keep our children and staff safe. We have a great trust and confidence in the approach the Minister and his department have developed in response to COVID. After much discussion with the Minister, the Department, and Public Health, we have decided to close our schools after December 18th. So the last day of school will be December 18th, and not reopen to students until January 11th. We are doing this out of an abundance of caution. Christmas is coming, and we are concerned that as family and friends gather, even in small groups, COVID could show up. Just look what happened in some of our western provinces after Thanksgiving weekend. They saw an uptick in cases. If COVID decides to join Christmas gatherings, cases can be identified before kids return to school. It's that 2-week period as we did when it came to closing other businesses. It is our hope, though, this will not happen, because there will be other restrictions and protocols that we will put in place for Christmas, and Dr. Strang and I will have more details on those next week. But we believe that shutting schools down for an extra week is precautionary and protective. Teachers will report to work on January 4th for professional development around inclusive education and the use of technology in our schools. Dr. Strang.
Thank you, Premier, and good afternoon, everybody. So, as the Premier said, today we are reporting 9 new cases of COVID-19 in the province. 3 of them of the new cases are in the Western Zone, 1 in the Northern Zone, and 5 are in the Central Zone. 2 of today's positive cases and 2 from yesterday are connected to the outbreak at the poultry plant in the Annapolis Valley. One of the medical officers of health on my team is leading the response along with NSHA Public Health and the Department of Environment Public Health Inspectors. And we're working very closely with plant management. And I do want to thank that management team and the company for their ongoing collaboration through what is a difficult time for them. The plant closed temporarily on Wednesday, and given the emerging virus activity, we have decided to close that plant for another 2 weeks. The decision we had in front of us was keep the plant going, but in all likelihood have more cases pop up and have them and their contacts then isolate, or take the precautionary approach and close the plant now and have everybody at home isolating and tested. And as we've always been doing with COVID-19, our approach is to take the precautionary approach, to always err on the side of doing what's on the side of caution, doing what's necessary to stay out in front of this virus. So like always, we're taking strong action early. The people who have tested positive and all their identified close contacts in the workplace have been isolating. We have tested everybody who works at the plant, and we're awaiting a number of those results, and we will be doing repeat testing on those workers in about a week's time, and that is underway in terms of the logistics of planning that. And while there is no evidence of community transmission in the valley, we do want to stay ahead of the virus. And that's why we're increasing access to asymptomatic testing within the surrounding communities. The Nova Scotia Health Authority are working to open a primary assessment centre in Berwick. We will be sending one of our mobile testing units into the valley, and we're looking at how our rapid testing pop-ups will also be able to support this effort. I want to assure people that we are doing this out of an abundance of caution, and I would remind people that the personal measures that we've always are asking people to do, staying home if you're sick, wearing your mask, keeping your distance, washing your hands, those are what we ask you to continue to do to keep yourself safe. But we do need to be cautious and be looking for any signs of a virus in surrounding communities with our asymptomatic testing strategy. Folks may remember this is what we did in Wolfville when some research testing showed COVID-19 in some of the wastewater. We acted quickly, did a lot of testing through the primary assessment center in Wolfville, and also brought in a pop-up testing. And fortunately, we didn't show any positive cases. And that is what we hope will happen in Berwick and the surrounding communities. But we want to make sure that we're doing everything we can to detect anything and detect it early. So in Nova Scotia, we now have 65 active cases of COVID-19, and fortunately, we continue to be able to say nobody is in hospital. Since October 1st, there have been 313 cases in total. 248 of them can be now considered resolved. As I said on Tuesday, things are moving quickly on the vaccine front. And when I say quickly, I mean very quickly. I was in meetings all morning, and I have to thank all my colleagues, as well as the support that's coming from Canadian Armed Forces. We have moved a huge way forward from today compared to last week. Tremendous amount of excellent work is being done. People have probably seen the announcement from Health Canada that the Pfizer vaccine is now approved, and this was an important step that we were waiting to allow us to move forward to begin immunizing. On Wednesday of this week, we participated in a dry run where we received the Pfizer shipping containers, not with vaccine, but with dry ice. This vaccine needs to be kept at a minus 70 degrees, and so it has a very complicated distribution mechanisms that we wanted to test a run, and that was done as part of a national exercise. We also did a tabletop exercise with the National Operations Center focused on vaccine ordering and managing the supply early this week. This morning, I met along with our vaccine team with Major General Danny Fortin, who is leading the logistics nationally for the Public Health Agency of Canada. And this afternoon, our vaccine team will be participating in a national exercise focused on risk management and troubleshooting. So all of this is designed to test and refine our approach before the first shipment of vaccines even arrive. It is a complicated operation, especially with the Pfizer vaccine, given its unique storage and handling requirements. But I hope people can see by the work that's gone on and that I've just described that we are absolutely ready to receive vaccine and start administering that. So on Tuesday, December 15th, we are slated to receive 1,950 doses of vaccine, and then we expect to receive weekly shipments of vaccine for the first 3 months of 2021. The total amount of vaccine we are scheduled to receive during this time is about 150,000 doses, which is enough to immunize 75,000 people. And like other provinces, we're following the national guidance around priority groups. And during this initial phase of the immunization program, we will be focusing on long-term care residents and staff, frontline healthcare workers who are closely involved in the COVID-19 response, and older Nova Scotians in the community, beginning with those 80 and over, then 75 and older, and so on. These groups that I just described fall into one of two high-risk categories. They are either vulnerable to severe COVID-19 because of their age, or they're critically important in assessing and treating COVID-19 patients. That is why our priority for they are our priority for the first 3 months of 2021. In the spring, we expect to start receiving greater amounts of vaccine, meaning that we'll be able to move to other healthcare workers and essential workers. And we expect it'll be summer before we are able to start offering vaccine to the broader community. I know people are eager to get a COVID vaccine, and that's encouraging, but we need people to be patient. We need you to understand that this is going to be a months-long process, and that our rollout will follow a national evidence-based approach when it comes to who gets the vaccine and in what order. There are already many organizations, professional groups, and individuals asking when they can get the vaccine. I promise you that we will keep everyone updated throughout this process. We will have regular briefings like this one, and we'll be putting up-to-date information on our website and on social media. And so most importantly, people, please be reassured that you will get lots of notice when your organization or your professional group will be eligible and able to get the COVID-19 vaccine. One of the toughest parts of the pandemic, I know for me, and I'm sure for everybody who's listening, is the uncertainty around this. The vaccine is going to make a huge difference. We know that, but the uncertainty around when you're going to get it and when you'll be eligible, I get that causes anxiety. But please be reassured, we're rolling this out in a logical, evidence-based manner. You will hear from us, and it will take a number of months. In the meantime, while you're waiting for vaccine, or even after you get vaccinated, we will need to stick with our public health measures like wearing masks, keeping physical distancing. We know the vaccine, it gives short-term protection, and as we have more time with the clinical trials, we'll get better evidence on that immunity as the clinical trials go on longer. But also, what's not clear at this point in time is that even if you're immunized, there's still the possibility that you could be able to asymptomatically transmit the virus. So it's important, at least in the early stages, that people understand while we get more evidence, and this has all been researched, even if you're vaccinated, you're going to have to continue with the measures around distancing, masking, etc. Those are going to have to be in place for everybody as we roll through this vaccination program, and we'll get much more evidence to inform these kind of questions and the decisions around public health measures throughout 2021. So let me move quickly to where we're at around restrictions. The restrictions that are in the metro parts of Halifax and Hants County are in place up to and including this coming Wednesday, December 16th. We've not made any decisions yet about extending those restrictions, though, as the Premier said, those will come next week. But I can say that when we do decide to start changing restrictions, it will be done slowly and deliberately. So if you haven't already done so, please, you need to start planning for a different kind of holiday season this year. One that is spent close to home with people you love and in consistent small groups. One where we do much less in-store shopping and focus on supporting local businesses and restaurants with online and pickup purchases. And one where the gift we give and the love we show is keeping each other safe from COVID. And maybe in doing so, we learn or relearn what is really at the core of this time of year. So the impact of the pandemic does run deep, and I know it has taken a toll on the mental health of many Nova Scotians. I want people to know that I'm very cognizant of the impacts that COVID has had and is having, and the required measures that we're using. Those weigh on me heavily. So today I'm pleased to be able to announce the government is investing $1.6 million into the Mental Health Foundation of Nova Scotia's Community Grant Program. The foundation will provide grants of up to $25,000 to projects or initiatives that benefit the mental health of people throughout the province. These grants can be awarded to organizations and individuals. The application process will open on this coming Monday, and people can find more information on the Mental Health Foundation of Nova Scotia's website. We have had a great response to our call for people to come in for a test, even when they don't have symptoms. Since we've opened the walk-in testing site at the Sportsplex in Dartmouth, we have done more than 6,800 tests. And more than 1,100 people did the online process to book their tests. And as I said, the staff and volunteers at our rapid pop-up sites have done another 8,500 tests. So I continue to encourage people, especially those who have active social lives, people who have many close social interactions with different people or groups, to please take advantage, whether it's in the Halifax area, it's the walk-in at the Sportsplex. In other parts of a province, you can go in the online booking and book through the existing PACs. Recognize, but it's available for everybody, but especially encouraging people who have what I call active social lives. And by saying that, I'm not being judgmental. There's nothing wrong with having an active social life, but it does put you at more risk of COVID-19. So it's important that you understand that and then take advantage of this testing opportunity. But at the same time, also look at how you need to change behaviors, reducing your social activity right now while we're going through the second wave of COVID. And emphasizing to people again, this is not about judgment. You're not going to get in trouble if you come there and say to somebody, well, or the reason you're doing it is because you're at a large gathering. Nobody's going to ask you about that. We're not going to be looking for that. We're just asking you to make an assessment of what risk you may be in and the need for you then to come down and get tested. So you'll be able to go online and book appointments up until Sunday, and then we need that space to make all the appointments to get everybody through next week before we try to give as many people as we can in the healthcare system a necessary chance to get a bit of a rest and a break over the weeks around Christmas. I would also encourage people, if they're for whatever reason they're going for a test, to once you go in for a test at the PAC, take advantage of the opportunity and sign up to get your results through email. It's the quickest way to get your results if you have a negative test. If you are positive, please be reassured you will get a call from Public Health. But if your test is negative, the fastest way and the most efficient way for us is for you to sign up, and we can do it by email. So before I end, I want to echo something that Dr. Theresa Tam, our Chief Public Health Officer for the country, said yesterday. When she was talking about the rollout of the COVID-19 vaccine, she said, we need to remember that this is not a race to the finish, but a test of our continued collective effort and resolve. The vaccine rollout is moving quickly. But it'll take months to do that. We also recognize that we're approaching a time of year, the holiday season, that's going to have to be very different this year and probably disappointing for a lot of people. We're 10 months into our response and everybody's tired. I understand that. And I know it's challenging to have to, when we're asking you to limit your shopping, to postpone holiday parties, to not see family and friends because of travel requirements. So these few weeks are perhaps our biggest challenge yet, or as Dr. Tam said, the biggest test of our resolve. The trends in our numbers are very encouraging. They reflect everybody's hard work over the last few weeks. But today's news about an outbreak at the poultry plant in the valley is a stark reminder that we're not through this yet and things can change very quickly. I know that people are anxious and ready to get back to something a little more normal, but moving too quickly away from these restrictions can do the opposite. It could put us right back to where we were a month ago and prolong the need for extensive restrictions around COVID. What we need to see is the low single-digit case numbers that we're seeing, not for just a few days or a week, but for several weeks and beyond. So I know we've asked a lot of people for 2020, and I have been very humbled by the way Nova Scotians have shown up and continue to show up for this. All the things that you've done to keep your community safe, along with all the things that you haven't done, the family vacations you've canceled, the weddings you've postponed, the lives that have had to be grieved or celebrated in ways that never felt quite right. These sacrifices and all the others, big and small, you've made every day. They have helped make this province a safe place for everyone in the midst of this global pandemic. But I ask everybody that we need to approach the next few weeks till we get to the other side of New Year with that same resolve, the same willingness to do the hard things that are necessary to keep each other safe. And let me end by just saying, last night was the first night of Hanukkah, and I know for everyone celebrating that things were a little different than usual, as they need to be. But the Hanukkah celebration of light is more important this year than ever. It's a celebration of light, love, and hope. And these are the things we could all use a little more of. So from me and my family to yours, to those who are celebrating, I wish you a safe and happy Hanukkah. Premier.
Tina?
Again, just a reminder, we'll take one question and one follow-up from reporters on the line in the time allotted. We'll start with Carolyn Ray from CBC. Go ahead, Carolyn.
Hi there. With the second case now at Shannon Park Elementary, is there any more discussion about whether the younger kids should be wearing masks in school?
So we continue to look at that at a national level. The evidence continues to be that younger ages aren't as great a risk of transmitting the virus as older kids, and that I'm so comfortable that we're where we're at with our masking for grades 4 and up. Even though there's a second case in the one school, there is no evidence yet that the two cases are linked. So talking to my team earlier today, that the second case was not identified as a close contact as the first case. So we want to remind everybody that even though we're having a number of cases in schools, with one exception, there has been no cases that have been due to transmission within the school environment. What we're seeing is people that are exposed outside of the school and then happen to be infectious at some point early on in their infection, often when they're asymptomatic, in the school. As soon as we identify that, we isolate the case and their contacts. But other than one case where the transmission was on a bus, that we have not seen transmission within the school environment, even though we've had a number of cases now in the double digits of people who cases in schools. That to me tells me that the protocols we have in place, what we've been following, continue to allow our schools to be a safe place. There's no evidence to suggest that we need to increase our masking policy for younger ages at this point as part of that overall approach.
Go ahead, Carolyn, with your follow-up.
As far as the vaccine rollout goes, are there going to be any special instructions for people when they're in between their two shots? Will they have to isolate or anything during the process of getting vaccinated?
No, thanks for asking the question. This new technology, it's called a messenger RNA technology. So what it does is it take a piece of the genetic code of the virus that's part of the vaccine, that then enters the body, and what it does, it creates specific protein that's on the surface of the coronavirus and stimulates an immune response. So there's nothing in that process that can give infection to anybody. So there's no risk at all that people who are immunized are somehow going to be able to transmit the virus to others. That is impossible given the technology we're using.
Boy, I'm never glad you get that question.
Next, we'll go to Elizabeth McJeffrey from Global. Go ahead, Elizabeth.
Hi there. My questions today are for Dr. Strang. Just first, I wanted to know on December 15th, can you confirm when and where those first vaccines are going to be administered next week?
So we're not giving out specifics on that. There are, as you can imagine, there's a number of security issues around these allotments of vaccine. So we're not giving out the details of that. But please be reassured that there will be appropriate availability of. We're in the process of arranging pictures for media, et cetera, that will allow you to supplement the coverage around that.
Go ahead, Elizabeth, with your follow-up.
I'd also like to know if Nova Scotia is considering any exceptions to those priority groups that have been identified to vaccinate other people who are extremely vulnerable. For example, could a person who's in their 30s but severely immunocompromised apply somehow as a special case to get vaccinated early?
No, we're rolling out, we're like other provinces, we're sticking with our priority groups. Part of that prioritization is a recognition that as we start to immunize more broadly in the community, starting with people at age is by far the biggest risk factor for putting people at risk for severe COVID-19. But there are other health conditions that will be part of our prioritization once we get to the place where we're able to do broader community immunization.
Next, we'll go to Heidi Petracek from CTV. Go ahead, Heidi.
This might be a question for the Premier, or it could be Dr. Strang. I'll start with the Premier, though. What about security when it comes to vaccine delivery and storage? Have you had to do anything extra in terms of ensuring that the supply is safe?
I'm going to speak to that because it was part of my discussions this morning. So our military colleagues have part of that. We're also involved with the RCMP of a threat risk assessment, and they're doing all that work now. This is their area of expertise, and we've engaged them to do that around the supply chain and the locations where we will be actually offering vaccine. They're doing their work around that threat risk assessment. They've already started that.
Heidi, go ahead with your follow-up.
Yes, thank you for that, Dr. Strang. And also, how many people can you, when you start the immunizations next week, how many people can you immunize in a day?
I don't have that number in front of me. It's several hundred people. There's teams of people working on those kind of logistic details. We have about 2,000 people we can immunize with the first allotments. We can get back to you if necessary on more of those detailed information, but we can several hundred people a day for sure.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Afternoon, Dr. Strang. Just wondering if you've been able to pinpoint the cause of the outbreak at the poultry plant. I think the Premier mentioned that there's no community spread that's been detected, but have we nailed down how the virus made its way into the plant?
We know the initial two cases, their exposure was related to a household contact with an individual who'd been traveled outside of the province. As we've looked at the subsequent cases, they've had nothing in their movements and their activities outside of work that would have put them at increased risk for being exposed to the virus. So our conclusion has to be that they were exposed at the workplace. It's one of the key pieces of information which is leading us to taking the aggressive steps of calling this an outbreak in the workplace and doing what we're doing in terms of shutting down rapid testing, etc.
Go ahead, Keith, with your follow-up.
And I wonder if we can nail down exactly why you decided to, aside from abundance of caution, why you decided to extend the Christmas period. I know these discussions have been going on, but is there anything that a tripwire that you saw that you said, okay, yes, we need to be extra careful here? I just want some clarity on that.
Nothing in the epidemiology that would have us do this. What we have seen globally when we've seen holidays, as I mentioned in my remarks, like Thanksgiving in Western Canada, what's happening in other parts of the world on certain holidays, we were concerned, quite frankly, with the amount of family gatherings that would be taking place, people who would be in contact with each other. That if we closed it for the extra week, it would give us that kind of 2-week cycle from Christmas Day over to January 11th, that if there was any kind of an outbreak within our communities, we would be able to identify it before we actually had kids going back into school. This is really out of, caution, quite frankly, using some information that we would have received outside of public health, that we're just watching globally all the news that's happening in terms of what's happened around certain holidays. And we want to keep our kids safe. And this extra week will allow that, and teachers will go back on the 4th, and they'll do professional development and work on inclusive education as well as technology in the workplace.
Next, we'll go to François Pierre Dufault, Radio-Canada.
Good afternoon. I'm wondering, with the school being closed an extra week for Christmas, if there will be any arrangement to make maybe more daycare spots available during that period, because parents might not have arrangements made for their kids to be looked after during that specific period of time.
No, we're working with the Department of Education, work with our partners, but that's why we're giving, making the announcement today to give families an opportunity to prepare for that week. But this really is really a precautionary measure, and it's my belief, that families would want us to do everything we can to protect their kids, and that's really what this is precaution to do that. And we're giving people that extra period of time to find that child care.
Go ahead with your follow-up, François.
Yes, about the testing that has been done and will be done in and around Berwick. Maybe that question was answered already, but do we know, do we have all the tests from all the employees of the poultry plant back yet? And how many of them are actually positive?
The initial tests we did were using the rapid test. Those were at closest at highest risk, and those were all negative. But as we started to test lower risk employees, we have about 300 results, which we expect to come in. Most of those today. People were tested. It takes at least 24 hours to get the results back through the lab, and that's what in the early batch of tests from those lower risk employees has identified these additional 2 staff who were positive. So it's not impossible that we may get additional positives from this as well, knowing that where the concern is that there's been virus circulating in this workplace. It wouldn't change our actions. It would just strengthen the need of why we took action immediately when we got these 2 additional test results.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. This is for Dr. Strang, and continuing with the Eden Valley situation, can you go over the numbers there again? How many cases have been confirmed? I believe it's 4, but again, if you could go over that. And although there's no community spread right now, what's your level of concern for the community around that plant?
So you're absolutely right. There were 4 cases. There were 2 initially, which our action. One of our actions on that was to then test everybody in the plant, and then we've got 2 more. But we do have a number of results. As I said, about this morning, it was 300 results pending coming in from the lab. There's nothing to indicate that we're seeing a community spread in the Annapolis Valley. We've had other. We're still doing testing including in that part of the province. We're not pulling up other cases that we don't have an explanation for other than community spread. Again, I use the example of what we did in Wolfville as perhaps illustrative. There were some concerning things coming. We had a couple of cases in a nearby high school. Plus, we had the wastewater treatment a positive result, part of a research study. All of those were signals that we needed to pay attention to, and we do pay attention when we get those signals. And we rolled out increased access to testing in the Wolfville area through expanding capacity in the primary assessment center using the pop-up. Unfortunately, all those tests came back negative, which was very reassuring to us. And what it tells us is that even though we've tested large numbers of people asymptomatically, we had no positives. Again, very reassuring that we're not missing something in terms of community spread. We're taking that same approach now in the Berwick and the surrounding communities. There's certainly a serious event happening in the plant that we need to pay close attention to, and part of that paying close attention is the question that we always have is, are we missing something in the surrounding communities? The aggressive approach to asymptomatic testing in the days ahead will answer that question.
I think it's also important to recognize that each one of those cases would have had close contacts at the workplace, which meant they would have had to isolate as well, and extra precautions would have been taken, which actually would have continued to create real challenges for this work site to continue operating, and it could have actually spread out the virus for a longer period of time. It's why public health and Dr. Strang and his team, give him a tremendous amount of credit, are taking the approach they're taking. While we've identified so far 4 people, there are others who would have been in close contact, and this is a chance for us to really wrap our arms around this plant, have all of them recognize the seriousness of this, help quarantine, help make sure they protect their family and community, and allow them to get back to work as quickly as possible without impacting them in the new year.
Go ahead, John, with your follow-up.
Thank you. This is for Dr. Strang or the Premier. There are mounting concerns from bus and ferry operators about the number of people who refuse to wear a mask. Dr. Strang has addressed this before, and you've shied away from mask enforcement, but I'm just wondering whether the province is considering any measures to address this problem.
Well, we continue to see the vast majority of Nova Scotians responding to wearing a mask. We have continue to see it even when you're walking on the street, where people are wearing their masks every time they're outside of their place. But you're right, there are those who are not. Some of those are obviously for different reasons. I was reading an article out of Edmonton where there are a number of Albertans who have criminal charges because of the interaction between themselves and someone who wasn't wearing a mask. All we're asking people to do is put a mask on. This is not, we're asking you to be kind to each other. We're not asking other Nova Scotians to go enforce this. But we are asking each other just to think about this for a moment in time. If you have anybody that you love and you care about, anyone that's really important to you, anyone that has made a big impact on your life, wouldn't you want us to wear a mask to protect them? Wouldn't you want us to do something as simple as put a mask on so that we made them safer? All we're asking you to do that for us. It's not a big ask. We don't want to have to be in a position where we're forcing people to do certain things. We're asking you to work with us here. And if you can't think about wanting to protect the people we love, why don't you think about it in the fact that we're protecting the people you love? So just kind of meet us halfway.
Next, we'll go to Lindsay Armstrong from allnovascotia.com. Go ahead, Lindsay.
Thank you. Premier, recognizing the necessity for this 2-week closure at Eden Valley given the outbreak, I'm wondering if there's any concerns around the impacts of food supply given that this is the only federally licensed chicken plant in the province.
Well, obviously that's a concern. It's why we quickly have worked with public health. As I said, there were many. This workplace, there's lots of contacts in it, so if we do as we're doing now, work with that company, we'll work with chicken producers in the province, then this plant will be up and going before the new year, once we get control of making sure that this hasn't spread out in the community and the fact that we've done work. And I want to really give a shout out to the company itself. Dr. Strang's people who have been down in the valley in public health talked about this company, took tremendous steps to protect their employees, and we're working with them, and we're taking this step today to make sure that we control this, and that means that plant will be shut down for a period of time, but it'll be up and going again. And the minister is, along with public health, is in contact with them now and working with the industry to ensure that we can continue the production as it goes along.
Go ahead, Lindsay, with your follow-up.
Thank you for that response. I understand there was at least a shift at the plant yesterday. When was the decision made from that first closure to this more longer closure? When was that decision made?
I think that, yeah, go ahead, yeah.
So the decision was actually made on Tuesday night that we were going to close the plant, and at the time it was looking like it would have to, close for a short period of time. The plant closed on Thursday. As we worked with them on Tuesday night, they clearly indicated, and I fully understand, that they needed 24 hours to try to ramp things down to safely close down the plant to deal with the chickens that they already had in the plant. So they had that 24-hour period. That decision was made Tuesday night. The plant closed on Thursday. It will now remain closed for another 2 weeks.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, Premier. On Wednesday and Thursday, there were a series, 13 high-profile RCMP raids across the HRM. Many of those were in highly urbanized areas during rush hour with lots of people. We've seen scenes of police vehicles rushing through rush hour traffic, pedestrians jumping out of the way. We saw a police raid across the street from the high school in Bedford just as hundreds of students were being released. Are you concerned that the RCMP demonstrated a disregard for the safety of the public during these raids?
Well, anytime you see that level of police activity in our province, you're obviously concerned, but we have to allow law enforcement to make the decisions they make. We will obviously look at those in hindsight as it goes on, but I think every Nova Scotian, some of the scenes we saw are not things you see in this province, not something that typically any of us would see. And it is up to the RCMP to explain to the province and to the citizens why that action was taken. I know the Attorney General is, concerned about what's happening, and we expect to hear from the RCMP to communicate to Nova Scotians. If there's anything we've learned in the last 10 months, communications to individual Nova Scotians matter when it comes to law enforcement.
Go ahead, Tim, with your follow-up.
Dr. Strang, I just have a question about the policies of releasing information related to school-based cases. All the other cases, there's some cause attributed to them, whether it's a close contact or related to travel. But when there's a school-based case, public health doesn't mention the transmission cause. Is there a reason for that, or can you shed some light on that?
So it is included. When we talk about cases, we don't talk about, in any circumstance, about unless we're talking about we have a single case, we're talking about a new case in a day. We always, where possible, whatever we can say, attribute what we know about potential exposures. But we try to talk about that in aggregate. So we talk about, yes, we've had X number of cases a day. This number of them were related to travel. This number are known to known to be contacts of previously known cases. And then this number of those we don't have an explanation for. So we try to talk about it in aggregate, and those aggregate discussions and the numbers would include the cases that are in the schools. But we try to avoid, wherever possible, talking about details on any individual case.
Next, we'll go to Victoria Walton from the Coast.
Thank you. My question is about the vaccine and travel. So as we're rolling out this vaccine to Nova Scotians and Canadians in other provinces, at what point do the provinces and health departments of each province start talking about reopening borders between the provinces for people who've had the vaccine? Is that something that you've started thinking about yet?
I mean, there's the discussion nationally about, I think you're talking about this vaccine passport. But I think we have to understand that, as I said earlier in my remarks, that the evidence so far, and these are new vaccines, and I'll say a couple of things to qualify new. It doesn't mean that they haven't gone through the same assessment to be actually licensed. They've gone through the same assessment of safety and effectiveness. It's just that because of a particular focus on just this vaccine, that's been able to be done faster. But they're new from the extent that we still don't have evidence around what is the long-lasting immunity. They're still under the vaccine trials are underway, and they're going to continue. That will add to this evidence around the effectiveness of the vaccine longer term. One of the pieces of evidence that we don't yet have an answer on is it possible that even though I'm vaccinated, that I could still be infected and be an asymptomatic transmitter of the virus? That question is being actively studied, but we don't have an answer to that. So until we have an answer, we have to go on the assumption that that could be possible, and that everybody needs to continue, even if they're vaccinated, in the short to medium term, to act and follow all the COVID precautions. And so, even though we're talking about having these travel passports, we have to act that there's just no guarantee that right now, from what we know, that the vaccine can guarantee that you're not able to transmit the virus. So we have to continue to base our measures on that understanding, and knowing that there is research coming that should give us a much more definitive answer on that over time.
And our border is actually not closed. It just means that if you come here from outside of Atlantic Canada, you have to isolate for 14 days.
Go ahead with your follow-up, Victoria.
So in terms of the vaccine, for Dr. Strang as well, I think, what would you say to those people who are listening to this who are a bit vaccine hesitant because they've heard about how quickly it was approved and all of these things, and about how new it is? What type of research or where do you hope that those people consult and learn more?
So we'll provide more information as it becomes available, as we learn more through the research. But I'll come back to, and I heard one of my colleagues, Dr. Joanne Langley at the IWK, give a very nice answer to this on a CBC interview a couple of days ago. The fact that the fact that this virus went from concept to development to licensure in a much quicker time than any other vaccine does not mean that it hasn't gone through the same rigorous process of testing safety and effectiveness. It's simply because with the need in a pandemic, there was a singular focus from researchers to focus just on this vaccine. There was a singular a change in the process around the assessment by the regulators, that rather than waiting for all the evidence to be gathered and then given to the regulator and then they take their time to assess it, there was this rolling process. So as evidence evolved, it was given to the regulator, and the regulators in Health Canada gave us specific focus on a very rapid but thorough assessment of that evidence as it came in. So the process was much faster simply because everybody sped things up, and it was their sole focus. It does not mean at all that any of the necessary steps along that regulatory process were shortcut or changed. We have this vaccine, or any of the COVID-19 vaccines, will have gone through the same steps to prove safety and effectiveness like any other vaccine that we make available in Canada.
Next, we'll go to Jack Julian from CBC. Go ahead, Jack.
Thanks, Kana. My question's for Dr. Strang. The new school start date is January the 11th. So counting back 14 days, that new start date will protect from COVID exposures up to December 27th. But I'm wondering about exposures that would happen in the next 4 days leading up to New Year's and New Year's Eve and stuff like that. What is it that makes January 11th the safest back-to-school choice rather than a week later on January 18th?
Well, I mean, it's about, and we expect a lot of those activities. Could people be so active and expose each other afterwards? It's possible, but delaying for another week gives us a good level of reassurance. And we also know that we do need kids to get back to school. So certainly delaying for a week is another measure of caution and reassurance. And then we'll continue to monitor our COVID activity and respond to any cases in schools like we've been doing for the last number of months.
And I think it's important to recognize the epidemiology is not there for this decision. This decision was made purely out of precaution for our kids in and around the holidays. Teachers will start on the 4th. and students will come back on the 11th. And if we, as we've seen around other holidays, that will be enough time for us to get a sense of whether or not there has been a surge over the holidays. This really, though, and I want to thank Dr. Strang, as he's been working very hard with the department. We put in great protocols around our schools. When anytime COVID is in, we put them out for at least a few days, the cleaning, we do quick contact tracing. This really is out of precaution. An extra week home is one that I'm hoping families will take to continue to reading with their children, continue to find ways to make this holiday a little less stressful for them. And we look forward to welcoming them back in our schools on January 11th.
Go ahead with your follow-up, Jack.
My second question is about Dr. Shelley Deeks. So Nova Scotia has hired this international expert in immunization from Ontario, so congratulations on the hire. And she's going to be surveillance medical officer of health, but I'm just wondering what her role might be in the vaccination rollout.
I'm very pleased that Dr. Deeks has agreed to take the opportunity in Nova Scotia. She's already, by phone calls, by emails, she's already contributing and providing her expertise to our team. She's co-leads the NACI group, which is looking at the COVID vaccine. So we certainly will be using her expertise to inform our work around the COVID vaccination program. And she's very graciously offered to already start to provide that information by distance to our team even before she starts here formally. And we've already had, my team's already picked up the phone and called her, and I've talked to her a few days ago in an evening to kind of pick her brain on some things. So we are very fortunate to have somebody of her caliber come here to Nova Scotia and to graciously offer her expertise even before she officially starts to work with us.
And that's all the time we have for questions today. Go ahead, Premier.
I want to welcome her, but I also want to give a shout out to the public health team that we already have here. Dr. Strang, you and your team have been working tremendous work, and it is nice that we see high quality talent who wants to come and join you. But on behalf of all Nova Scotians over the last 10 months, thank you for the work that you've been doing and your teams out across our province. So thank you.
Thank you, Premier.
As Dr. Strang outlined, we will be receiving our first shipment of vaccine next week. Public health is working with our partners, and soon our frontline healthcare workers will be getting a shot in the arm. This is great news and only the beginning, and it will take many months before we all get vaccinated. So it's what we do while we are waiting that will matter. That will determine how we come out of COVID. I am concerned about the cases we reported today. There is no sign of community spread at this point, but it is yet another indication that COVID moves quickly and it can be hard to stop. And so we have to watch our movement. Dr. Strang and his team will take a close look at the epidemiology in every community and try to get ahead of the virus and understand it better, where it's hanging out. The information will be important as Dr. Strang and I make decisions about restrictions over Christmas. Movement matters. Where we go, what we do, who we're with, and how we behave. I know how important Christmas is to families, especially those who are spread out across our province. But it is our job to do our best to keep you safe. We will have more to say about this next week. And I know this is hard on everyone. As Dr. Strang said in his remarks, today we announced more than $1.6 million for community organizations across our province to help people access mental health supports and services. This is a very difficult time. But I don't want you to lose hope. A vaccine is on the way, and that is a very positive next step. And while it's hard to imagine a world without COVID, if we keep following the protocols, making the sacrifices together, we will be okay. So please, just hang in there. Be kind to one another, be patient, and have a safe weekend.